everyone, this is your friend Jenny and welcome back to Nursing Digipedia.
Today in this video, we will look at a complete blood count report, which is also known as a full blood count report. We will learn the full terms of various components in it and as well as what they indicate when the normal range varies.
We have experienced that whenever we go to see a doctor, our doctor often requests to execute CBC report, right? Well, a CBC report is a very common type of test and it doesn't require any kind of preparation. You can do it anytime and the results are available normally within 24 hours. Now, you might be wondering why a doctor requested this test. Well, it is commonly used to identify and evaluate your overall health, such as anemia, infection, as well as to detect and monitor a variety of health issues as an abnormal increase or decrease in the cell count as shown in the complete blood count may suggest that you have an underlying medical condition that needs further evaluation. So let's start and learn about this report. However, before we start, as a disclaimer, this video is only for the educational purpose. So always consult your doctor on your report.
This is an example of a CBC report. In different labs, the format of this report may alter. In this report, under the test part, you can see the various components of blood followed by test result and reference range. WBC stands for white blood cell. It is a part of body's immune system and they help the body fight infection and other diseases. The normal range in adult is between 4,500 to 11,000 per microliter. The normal value ranges may differ slightly between laboratories. A high count in the cell can indicate a range of conditions, including infection, inflammation, injury, and immune system disorders, while the low count may indicate that you are at risk of illness since you have less WBCs to fight infection. There are 5 major types of white blood cells. Neutrophils ranges between 55 to 73%. It protects the body by swallowing the bacteria. Lymphocytes, it ranges between 20 to 40%, protects the body by producing an antibody, mainly B lymphocytes and T lymphocytes. Monocytes ranges between 1 to 4%. They consume the dead or damaged cells, hence called as cleanup crew. Eosinophil ranges between 2 to 8%. They kill parasites and contribute to allergic reaction. Basophil ranges between 0.5 to 1%. They release histamines during allergic reaction. RBC stands for red blood cell. It is produced in the bone marrow. Red blood cells contain a protein called hemoglobin, which carries oxygen from the lungs to all parts of the body. Reference range is for men in between 4.35 to 5.65 million per microliter, for women in between 3.92 to 5.13 million per microliter. In children, the threshold for a high red blood cell count varies with age and sex. High count indicates that your bone marrow produces an abnormally large number of RBC. This can cause blood thickening, slow blood flow, and finally blood clots. A lower RBC count, also known as anemia, can affect the body's ability to transport oxygen and nutrients around the cardiovascular system. HGB stands for hemoglobin. Hemoglobin is a protein found in red blood cells that transport oxygen to organs and tissues and carbon dioxide from organs and tissues back to the lungs. Normal range in adults considered to be, for men, 13.2 to 16.6 grams per deciliter. For women, 11.6 to 15 grams per deciliter. A high hemoglobin count indicates that your hemoglobin has an increased oxygen carrying capacity than normal. It causes the body to make too many red blood cells, causing the blood to be thicker than usual. A low hemoglobin count indicates that the oxygen carrying capacity of your hemoglobin is reduced. A low hemoglobin level is referred to as anemia or low red blood count, though there are many reasons for anemia. MCV stands for mean corpuscular volume. This is a value related to your red blood cells. Your blood contains three types of corpuscles: red blood cells, white blood cells, and platelets. The average size of your red blood cells, commonly known as erythrocytes, is measured by an MCV blood test. Normal range in adults considered to be 80 to 100 femtoliters. A greater MCV score suggests that the red blood cells are larger than normal. Large red blood cells do not induce symptoms on their own. They can, however, assist in providing information regarding underlying health issues. MCV less than normal indicates that your red blood cells are smaller than normal, microcytic. Microcytosis is usually a result of the inability to form hemoglobin, which is a protein that is responsible for delivering oxygen in the blood. MCH stands for mean corpuscular hemoglobin. MCH value is the average quantity of hemoglobin found in a single red blood cell. Reference range in adults considered to be 27 to 33 picograms per cell. These numbers may differ depending on the machine used to perform test. In young children, the numbers are different. High MCH value can often be caused by anemia due to a deficiency of B vitamins, particularly B12 and folate. Your body requires these vitamins in order to produce red blood cells. A low MCH value is usually indicative of iron deficient anemia. Iron is important for the production of hemoglobin. Your body absorbs a small quantity of iron from the foods you eat in order to produce hemoglobin. MCHC stands for mean corpuscular hemoglobin concentration. It is the average concentration of hemoglobin in your red blood cells. Reference range in adults considered to be, in most cases, 32 to 36 grams per deciliter. However, some labs consider a normal range to be between 33.4 to 35.5 grams per deciliter. A high MCHC means that hemoglobin is more concentrated than usual. It can also occur in conditions where red blood cells are fragile or destroyed, leading to hemoglobin being present outside of the red blood cells. A low MCHC, also known as hypochromia, means that there is a lower concentration of hemoglobin within a given volume of red blood cells and hence a reduced capacity to carry oxygen to the tissues. There are several limitations that can affect the accuracy of the MCHC reading. The RTWCV stands for red cell distribution with coefficient of variation. The purpose of the test is to see if your red blood cells are normal in size and shape. Reference range in adults considered to be 11.5 to 15.4%. A high RTW indicates that your red blood cells are not all the same size. If your RTW is excessively high, it could indicate a nutrient shortage such as iron, folate, or vitamin B12 inadequacy. A lower number suggests that the size of your red blood cells is uniform. This is desirable and not a cause for concern. However, having a blood-related condition with a low RTW level is still feasible. RTWSD stands for red cell distribution with standard deviation. This is a red blood cell metric that quantifies the variability of red cell volume per size. Reference range in adults considered to be 12.2 to 16.1% in adult females and 11.8 to 14.5% in adult males. Optimal result is between 39 to 46 femtoliters. A high RTW means that the red blood cells vary a lot in size. There are many possible reasons why the RTW level can be too high. A low RTW below 10.2% means that the red blood cells vary very little in size. PLT stands for platelets. They are tiny blood cells that help your body form clots to stop bleeding. Platelets are made in your bone marrow along with your white and red blood cells. Normal platelet counts range from 1,50,000 to 4,50,000 per microliter of blood. For women, the average platelet count is between 1,57,000 and 3,71,000 per microliter of blood. For men, the average is between 1,35,000 and 3,17,000 per microliter of blood. A high platelet count can suggest either essential or reactive thrombocythemia. An abnormal high platelet count indicates that clotting may occur spontaneously. A count lower than 1,50,000 platelets per microliter of blood is considered to be thrombocytopenia. Below 10,000 is considered severe thrombocytopenia with a risk of internal bleeding. MPV stands for mean platelet volume. It is the measure of the size of the platelets in the blood. Normal range in adults considered to be 8 to 12 femtoliters. A high MPV indicates that platelets are bigger than average. Larger platelets are more reactive. This is sometimes a symptom that the body is manufacturing too many platelets. A low MPV can be caused by exposure to certain medicines that are toxic to cells. It could also be a sign of marrow hypoplasia, a condition that causes a decrease in blood cell synthesis. PDW stands for platelet distribution width. It reflects variability in platelet size and is considered a marker of platelet function and activation. This marker can provide you with further information about your platelet as well as the cause of a high or low platelet count. Normal range in adults considered to be the PDW median was 13.3% with a reference range of 10.0% to 17.9% for the 5th and 95th percentiles with a confidence interval of 95%. Optimal result is between 9.2 to 16.7 femtoliters. A high PDW means there is a great variation in size which may be associated with vascular, blood vessel, disease or certain cancers. A low MPV is linked to inflammatory bowel disease, chemotherapy, and certain types of anemia. PCT stands for platelet grid. It is a part of platelet indices and done during hemogram or CBC blood test. Normal range in adults considered to be 0.22 to 0.24%. High PCT can be related to ulcerative colitis, an inflammatory bowel disease that causes long-lasting inflammation and ulcers in your digestive tract. Low PCT can occur as a result of a separate disorder, such as leukemia or an immune system problem, or it can be a side effect of taking certain medications.
So friends, please subscribe to my channel if you want to be updated with such kind of informative videos.